Imagine needing medical attention but being unable to communicate your symptoms or understand your doctor's advice. How would that impact your healthcare experience? For many non-English speakers in the U.S., this is a daily reality, and it's becoming increasingly challenging due to recent policy changes. Under the Trump administration, budget cuts have left healthcare providers scrambling to maintain qualified medical interpreters. This has complicated communication between patients and healthcare providers, especially for those who don't speak English fluently. An executive order declaring English as the official language of the United States has further muddled what services should be offered, leaving both providers and patients confused. The implications of these changes are profound. Without proper interpretation services, patients face serious risks, including potential medical errors due to miscommunication. Health advocates express concern that these barriers could lead to poorer health outcomes for non-English speaking patients. Vanessa G. Sanchez from KFF Health News highlighted in WAMU's Health Hub segment that such policy shifts might exacerbate existing disparities in healthcare access and quality. The fear of misunderstanding or being misunderstood may discourage patients from seeking care altogether, or worse, result in them receiving incorrect treatment. Consider Maria, a Spanish-speaking patient with diabetes living in Texas. She recently experienced confusion during a routine checkup because the clinic had reduced its interpreter services. Without proper communication, she left the appointment unsure about her medication adjustments. This scenario isn't unique to Maria. It reflects a growing issue across many communities. What happens when those who need help are too frightened to ask? Sanchez poignantly asked during her segment. This question resonates deeply because it touches on the emotional aspect of healthcare, the trust and security every patient deserves but which is undermined by language barriers. As we reflect on these challenges, it's important to consider, how can we ensure everyone receives equitable care? One approach is advocating for policies that prioritize interpreter services as essential components of healthcare delivery. Additionally, fostering cultural competence among healthcare providers can bridge gaps not just linguistically, but also culturally. Support policies that fund interpreter services, encourage cultural competence training for healthcare professionals, and engage community resources, such as local advocacy groups, to support non-English speaking patients. The path forward requires collective effort and empathy. As we ponder these questions and actions, let's remember that effective communication is foundational to compassionate care. How might you contribute to breaking down these barriers within your community? By addressing these issues head-on, we can create a more inclusive healthcare system where every voice is heard and understood because everyone's health matters equally.